Thank you so much for being here. Welcome to Illinois State University, the Department of Health Sciences, and our 2024 Anne E. Nolte Scholar presentation by Dr. Mona Hanna-Attisha. My name is John Matkovic, and I'm an assistant professor in our Health Promotion and Education Department. In our department and program, we offer an online Master of Public Health and undergraduate programs in public health, school health education, and integrative health and wellness. Just for some background, the Nolte Scholar Program started in 2001, and our first scholar was John Sefrin, the then president of the American Cancer Society. The Scholar Program was funded by Dr. Nolte after her retirement in 1997. Although she passed away in 2009, her legacy continues today. Dr. Nolte was a pioneer in health education. She came to ISU in 1973 to start our program in health education. By that time, she had already made significant contributions to the field through research, establishing the value of health education in schools. We've had many distinguished scholars over the years, and when we all discussed recognizing a scholar in public health, Dr. Mona Hanna-Attisha came to mind. Dr. Mona Hanna-Attisha is the Associate Dean for Public Health and the C.S. Mott Endowed Professor of Public Health at Michigan State University College of Human Medicine. She is the founding director of the Pediatric Public Health Initiative, an innovative partnership of Michigan State University and Hurley Children's Hospital in Flint, Michigan. A pediatrician, scientist, activist, and author, Dr. Hanna-Attisha was named one of Time Magazine's 100 most influential people in the world and recognized as one of USA Today's Women of the Century for her role in uncovering the Flint water crisis and leading recovery efforts. She is reimagining how society can come together to eliminate infant poverty with a first-in-the-nation program, RX Kids. Dr. Hanna-Attisha is the author of the widely acclaimed and New York Times 100 Most Notable book, What the Eyes Don't See, a story of crisis, resistance, and hope in an American city. Not just as a faculty member here at Illinois State, but as a former Michigander and graduate of Michigan State myself, I'm very pleased to introduce our 2024 Nolte Scholar, Dr. Mona Hanna-Attisha.
Oh, thank you, John, for that beautiful and kind introduction. It is great to be here with all of you today, albeit virtually. Thank you for this opportunity to connect. It's also wonderful to be part of this kind of named lectureship with so many other folks, incredible folks who've done some beautiful work in public health. So I look forward to the conversation, and I look forward to interacting with all of you. I'm pretty good at multitasking. So if you put something in the chat or a comment or a question, I'm happy to also work and respond to that too. So thank you, and I can't wait for the conversation.
Okay, great. Yeah, I know we have kind of our first introductory question that I think will help everybody who may know already, and for those who are a little bit less familiar. But in our program, students have read your book, What the Eyes Don't See, for the past couple of years in our community public health course. But there might be people here in the Zoom that are either unfamiliar with you or the book itself. Could you tell us a little bit about your background and how you came to be involved with addressing the water crisis in Flint?
Awesome. Great question, John. I'll spend about an hour answering that question. Just kidding. I will try to be brief. But where to start? So I am a pediatrician, still a practicing pediatrician. I spent all day yesterday taking care of babies and kiddos. I'm also an academic. So I, at the time of the water crisis, I was a residency director, so really kind of charged with the training of a future pediatric workforce. But also, after I finished my medical training, I love taking care of kiddos. It's my most fun thing in the world, but I quickly realized, and I quickly got frustrated, it's great to take care of the kid in front of me and to, do a lot of prevention work, which is what we do in pediatrics, from immunizations and safety and injury prevention, all these different things. But my hands are tied so often, and I keep treating kids with like gunshot injuries, and why aren't we addressing gun violence? And I keep taking care of kids with asthma exacerbations, but we're not addressing air quality. So shortly after becoming a doctor, I went back and got my public health degree in health management and policy to be able to have those other tools in my kind of my doctor's bag, to be able to address big kind of public health issues. And I think so many of us that went into medicine maybe kind of went into medicine accidentally, like maybe we should have just went into public health because we really want to address the health of a population rather than one patient at a time. And the way that our healthcare system is right now, it's very reactive. It's more of a kind of a sickness-based system rather than a preventative system. So got my public health degree, and the opportunity came in 2011 to come back to Flint, which is where I did part of my clinical training as a medical student, to be in charge of a residency program and to try to integrate medicine and public health. At that time, Michigan State University was about to take a deep dive in Flint in public health, working hand in hand with the community, asking the community, hey, if we were going to build public health in Flint, what do you want us to do? What kind of researchers should we hire, and what kind of issues should we address? So it was a public health enterprise that was built in a very community partnered and community driven way, which was really exciting for me to be a part of and come back to. So working in Flint, practicing as a pediatrician, and the same year that I came back to Flint in 2011, something else happened to Flint in 2011. And if somebody knows, they can put it in the chat. Does anybody know what happened in Flint in 2011? And I don't think it's related to me coming back, but the timing is a bit serendipitous. So in 2011, I don't see anything in the chat. Something happened to Flint that was happening to many cities in Michigan. And it was something that was happening like against the will of the people. The people of Michigan in a statewide ballot said, we don't want this thing called emergency managers that can come in and take control of a city, essentially usurp democracy overnight. But this thing, emergency manager law passed through our gerrymandered legislature, was pushed through. And in Michigan in like 2013, 14, 15, 11, all that time, in a city after city was taken over by emergency managers. And at one point, half of the African-American population in Michigan was under emergency managers compared to just 2% of our white population. So totally undemocratic. And I share this because the Flint story is many things, but it's also a democracy story. And it teaches us, it reminds us that when we do not have whole and representative democracy, it hurts people's health specifically. And that this is not an isolated thing. There's efforts kind of across the country that make it hard for some people's voices to be heard. So in 2011, unrelated to me coming back, Flint lost democracy and was under financial emergency management. And their goal was austerity, save money, cut costs, because our city was near bankrupt. And there's many reasons why, also not accidental, loss of tax base, disinvestment, corporate greed, white flight, the list goes on and on of why we were in this spot anyways. And the decision by the emergency managers was to change our water source from the Great Lakes to the Flint River. And I hold up my hand, and John knows why I'm holding up my hand. Oh my gosh, but I'm not really raising my hand, but I love that. Okay, so John, work with me here. So why do Michiganders hold up their hand?
It's so we can tell people where we live. Like when I say I was born up in the thumb and then lived down in the corner of a little bit south of Detroit.
Yeah, so we're the Mitten State. We're surrounded by the Great Lakes. So we're a peninsula. And here's Flint, kind of in the middle, almost in the middle of the largest source of fresh water in the world. So 21%, and this is kind of the great irony of the story, 21% of the fresh water in the world is around Michigan, and here's Flint. And for half a century, we were getting our water from the Great Lakes, which we bought from Detroit. But these emergency managers decided, hey, that's too expensive for this predominantly poor, predominantly minority city. And we're going to change your water to save money from the Great Lakes to the local Flint River. And that's what happened in April of 2014. So almost exactly a decade ago is when our water was changed under this bizarre state of usurped democracy from the Great Lakes to the local Flint River. And it happened without proper treatment. So it was, once again, poor quality water, but also it wasn't treated properly, which made the water really corrosive. The water was so corrosive that in one of our, Flint's the birthplace of cars and General Motors, and in one of our car plants in Flint, the water was corroding car engine parts. And this just happened a few months after our water switch. And General Motors was allowed to go back to Great Lakes water. And throughout, for about a year and a half, the people of Flint were told to relax, that everything was okay. So for a year and a half, I was practicing as a pediatrician, training other, residents and medical students, and patients were coming in and complaining about the water, saying, my kids are getting rashes. Are you sure I should give my kid water instead of juice or pop? And in my Dr. White Coat confidence, I was telling my patients, of course it's okay. Like, oh my gosh, how can it not be okay? This is America, the 21st century. We have rules and laws, and we're in the middle of the Great Lakes. And everybody in charge, despite all the concerns, everybody in charge in government and was reassuring the people of Flint that the water was safe and that it was fine. And that's what I was telling my patients for a long time. And then that changed for me when I heard about the possibility of lead being in the water. Anybody in public health anybody knows lead is bad. It's a toxin. We've known about its badness for centuries. This corrosive water was so corrosive, it was eating up our drinking water infrastructure, which throughout the country has a lot of lead in it. So my role after hearing about lead in the water was to do the research that exposed kind of that kids had increased lead in their bodies, shared that research publicly, which didn't go that well, just like anybody who'd raised concerns about the water, but persisted because our science was right. And it was, this was about kids. Finally, the state conceded and admitted, yes, there's a problem. And since then, my work has been kind of on our path towards recovery and making sure that we don't continue to have these kinds of problems. So that was a long answer to your question, but like my story is about helping uncover the Flint water crisis, but really sharing that this is not this kind of one-off thing that happened in this one place, but that there's so many lessons about everything that we do, especially in public health. It's about it's about the disrespect of science and the voice of scientists. It's about our failure to invest in prevention and an adequate kind of public health kind of infrastructure. It's about deteriorating crumbling cities and kind of our lack of investment in roads and bridges and pipes and all these things that are also important for public health. It's also a story about environmental and public health injustice and about inequities. What happened in Flint, it follows a long history of environmental injustices where people of color, poor people, are disproportionately impacted by things like environmental contamination. And once again, it's also a story about kind of what happens when we take away democracy and people's voices. So this is not a unique story. It's about injustices that so many folks face, but ultimately it's also a beautiful story about the power that we all have to not accept the status quo and to do better on behalf of our kiddos.
Great. Yeah. Thank you so much for, and like you said, I'm sure a lot of these topics everybody could talk for a very long time about. But we do have some questions too from students that they had submitted prior, and kind of following up on that as you talk about the true story is really getting this out there and trying to help people. How were you able to stay motivated in discovering the truth while, as in some articles and the book itself, while so many people or departments seem to be against you?
That's a great question. When I shared the science that kids had more lead in their bodies, I felt great. I'm like, yeah, like I'm sharing science. Like it's just like numbers and statistics. Like, can you guys imagine being in the middle of like a public health crisis and not listening to science? That was a joke because we all just went through COVID. But like I felt really good. I'm like, I'm just doing my job. I'm sharing science. And I was shocked and surprised, but I shouldn't have been, because everybody who had raised their voice about Flint was also dismissed and denied about the backlash when I did share that science and wanted to protect kids. So there, I wrote the book in the first person on purpose to have you be in my shoes and to go through that roller coaster of emotions that I went through from when I first heard about lead, being so depressed and sad, realizing it was entirely preventable, being angry, like this was the last thing the kids of Flint needed, to being kind of like, just like shocked that nobody else was like paying attention to this, but also, all the ups and downs. And And the ability to persevere despite everybody wanting to, have you be silent. Folks wanted me to close my mouth. They wanted me to close my eyes and kind of go about my busy business. And the ability to continue to speak and to continue to raise my hand was really only possible by realizing that this wasn't about me. Anybody who puts themselves out there in the public space will be attacked, especially in kind of our current kind of climate. But it was a recognition very quickly that, hey, this isn't about me. They can go after Dr. Mona all they want, but this is about something bigger than me. This is about my kids. This is about kids. And then also very much realizing, like, my work was research with lots of numbers and statistics and p-values. And it was a recognition that every single number in my research wasn't a number. It was a kid. It represented a child. And it was as if those kids kind of like jumped out of my spreadsheets and lifted me up and gave me the courage to keep going. So my ability to persevere was grounded in my recognition that my work was not about me, but about my why, my North Star, which is children. So, all of you are in this world, in this profession, because you care about people, you care about public health, you want to make the world a better place. So let that be your why, let that be your North Star, because there's going to be ups and downs in your career. And I think when you're able to kind of continuously ask yourself, like, why am I doing this? And if the answer keeps coming back, like, for people, for making things better, and for me, for kids, then it allows you to kind of overcome these obstacles. And I would just add, one reason I didn't want to write a book is because it's not a story about one person. If you've read the book, it's a story about a team. It's about an unexpected team that came together. And my work to kind of persevere and to accomplish all these things was only possible, and to this day, by working with so many other folks, unexpected folks, moms and pastors and journalists and water scientists and lawyers, all these folks that weren't really kind of part of my team. But when you make a team that is big and broad and multidisciplinary and diverse, you ask different questions, you come up with different solutions, but also you are there for each other during these ups and during these downs.
You had mentioned your book, and we do have a student question that is related to your book. And a student wanted to know, were you nervous about publishing your book? And what was your favorite section about your book after it came out, if you had a favorite section?
Oh, I love that question. Writing a book was really hard. So I didn't want to write a book. It's not why I went to med school and got my public health degree. But when this became a national story, people were like, oh, you need to tell your story. And like folks were contacting me that I'd never heard of, like agents and publishers and screenwriters. I'm like, go away, I'm so busy. Like, we just uncovered this crisis and we're like working on recovering. But then there was like this like voice on my shoulder, like, Mona, you love reading. Like you were like, you wanted to be a journalist when you were a kid, and you spent another year in college to take creative writing classes. Like I consume a book a week. Like I love literature. And they're like, you have to do this. I'm like, go away, I'm not doing this. And then I finally committed to writing a book when I met my editor randomly at an event in Washington, D.C. This guy came up to me. He's like, have you thought about writing a book? I'm like, go away. And he shared who he was. And he is in charge of a division, a publishing division at Penguin Random House, which is a big publishing company. And his focus is authors of color, but also social justice stories. And he was telling me about these other authors that he represents, including Ta-Nehisi Coates and Brian Stevenson and Trevor Noah and Ibram Kendi. I'm like, oh my God, I love these people. I love these books. And so that was how I got to yes to writing a book. Writing a book took 2 years. It was on top of everything else I had to do. At first, it was just going to be a Flint book, but if you've read the book, it's also very much about Mona and my background and my personal story and my family history. So it's also this immigrant book. And then when I finished writing the book, I wanted to make sure everything was accurate, which gets to answering your question. So I shared it with all the major characters in the book. and then also with other subject matter experts. So I shared it with a lead historian and a Michigan expert. And I shared it with, like, once again, all these other folks that were, that knew about what was happening. And then in the publishing world, it also went through legal review to make sure that I wasn't going to get sued for things like libel or whatever. So it was kind of, it went through a significant process to make sure that whatever was, in the book was going to be okay. So in that way, I wasn't that scared when it came out. But I'm sure some people weren't happy. And then the other part of the question is, like, what was my favorite part of the book? I loved all the rabbit holes in the book. There was, I had a word count limit when I was writing the book. It was supposed to not exceed 75,000 words. And I am just kind of type A, researcher. Like, I just kept writing and reading and researching and writing and reading. And my editor is like, turn it in, hurry up. And it was like over 90,000 words. And so I'll give you one example. One of my favorite sections is about a badass named Alice Hamilton, who I hope you all learn about. She is a public health hero. She was a physician a century ago, the mother of the field of occupational medicine, a lead expert a century ago, the first woman professor at Harvard. She's an amazing, amazing woman. She's in my book for about a paragraph, and I read 3 books about her, at least 3 books. And she's in there for a snippet. And, that is like similar to so many other parts of my book about, like, Flint's sit-down strike, or another favorite part of my book is about my great uncle Nuri, who fought in the Spanish Civil War. During this process, I was finally able to get his file from when his application for fighting in the Spanish Civil War from the Spanish archives. And that took months in research. So I have lots of favorite parts of the book, but it was a process. It was really, really hard. And I think I'll end with, there's a lot of really hard parts, but the hardest part was choosing a title. And I had 8 pages of possible title options. So lots of hard parts, but I'm glad I did it. And most surprisingly has been just this kind of being here with you today, and the kind of the unreal kind of take up of the book. And it's been the common read for dozens of universities, and classrooms read it all over. The state read for 3 states, and New York Times notable book. Like, I thought only my mom would read it and like it. So it's been wonderful to see so many other folks engage with it.
Great. And I know before this question, you had talked about, like, sticking through on this crisis, and I think it matched really well another question we had from a student. Overall, has this issue changed how you view and handle things, both from a healthcare and non-healthcare perspective? And then we can all say that this is how we would be in the face of an issue, but is it much different from what you thought it would be overall?
A lot of folks are like, wow, like you're doing something that doctors aren't supposed to do, or like, did you ever think you would do this? And my answer is always yes. Like, this is why I went into healthcare and public health. Like, my job description before the water crisis, like, I'm a clinician, I'm an educator, I'm a researcher, I'm an advocate. Like, this is why I went into these professions, to speak up and do better on behalf of my patients. And so in that sense, it's been an affirmation of my career choice. Obviously, never would I've anticipated it to this degree. So I think, like, that in the future work that I've been able to do, I think kind of building on what I've learned, I think kind of the lesson of building a broad team has been invaluable. But also, I think I've learned about, like, I relearned the power of storytelling. Like, when I wrote this book, I had to pick an audience. I had to pick, like, did I want it to just be like an academic medical science book, or did I want it to be a layperson book? And I purposefully decided I wanted it to be a layperson book. I wanted anybody, anywhere, to be able to pick it up and understand these concepts. And I think that's kind of atypical for academia and medicine. Like, we are taught to write in journals and different things where just a few people are able to digest that. So, like, I think it's important to share stories. My last publication was a USA Today article, about kids. So, I think I think in that respect, it's kind of affirmed the balance that we need between kind of science and narrative in terms of our ability to shape policy and public opinion.
We do have, I want to take a quick moment. We have a question in the chat for you that I think is interesting and good for everyone of all levels to hear. If you have experienced professional or compassion burnout, how have you taken care of yourself mentally or physically to combat that?
Yeah, I am human, just like all of you. So, reading is an escape for me. I used to stick with like nonfiction stuff, and I think for my mental health, my genre has expanded to like escapist novels as well. So like more fun things. So that's been helpful. I have two now teenage girls. I try to like be home and grounded with them, and that's good for my wellness. And I would just add, my work makes me well, which is probably not healthy, but I love, and I hope you can see that. Like, I love my work. Like, I love it. Like, if I wasn't doing my work, I wouldn't be well. So I think if you find something you love, you don't need an alternative, as much of an alternative to have that balance. I find joy in my work. It makes me happy. And I think that's kind of also, critical to be able to do all that. But yeah, I listen to music. I go on vacation, but I read. I try to, do all these other things. But once again, I love what I do.
I know you had mentioned this even just in one of your answers, but another question we have from a student is power is discussed in your book. What advice would you have for students who want to do more in their communities, but feel like they lack the power to do so?
Yeah, I would find friends. So I think we sometimes feel or think that we're the only folks that care about a certain issue. And I would find your peeps, find your allies, because and you'll find them in unexpected places. Like, if you care about, drinking water or democracy or women's reproductive rights, or, the list goes on. There's other folks out there that have probably been thinking and working on these issues for a long time. So don't reinvent the wheels, find your allies. And I think that's how you kind of are able to build power and broaden the tent as much as possible. Great questions.
Yeah, thank you so much. Another one from our students. What was the most shocking thing to you, if there was one thing, about all of the events you learned about during the Flint water crisis?
Oh,
if
I
there
think
was
the
just
most,
one.
oh yeah, there's many. I mentioned the corroding engine parts. That drives me crazy to this day. I think so, I shared the Flint story, and I shared how it was a story that we were near bankrupt under emergency management. They were doing this to save money. We later learned that the proper treatment for the water only would have cost $80 to $100 a day. So that was shocking, this was all done to save money, right? But like, it wasn't that much money to actually do the right thing. So then why wasn't it done? That's up there. That's top three.
Now, again, another question we have from a student, but just following up on you saying kind of what you do rejuvenates you, how satisfying was it to see a difference being made because of your actions in Flint?
Yeah, it's unreal. We, acutely, we uncovered the crisis, the state conceded, but we've been able to do a lot of amazing things, since then to help kids in Flint, but more importantly, to make a difference nationally. So, since the water crisis, I've testified half a dozen times before Congress, and most recently about the Infrastructure Act, which was signed by the president and is the largest federal investment in infrastructure and includes billions to replace lead pipes across the country. Like, that's because of Flint. The EPA a couple months ago released a new lead and copper rule, which I got to, be at the press conference with the EPA administrator, and it calls for better sampling, lower action level, and replacing all of our nation's lead pipes in 10 years. Like, that's because of Flint. So like there's all these amazing ripple effects that our work has been able to accomplish that really are about primary prevention, about making sure that, we do learn some of the lessons of Flint and respect science and invest in prevention. So I think, it's about, taking advantage of moments. There's been people that have been working on these issues before I was born, and then there was this kind of window up of opportunity and policy that we were able to jump through to be able to do the right thing. So it's been, once again, unreal to have had such an impact, and the work continues. My work now, very much in the same spirit of everything that we've done, is trying to once again learn a lot of these lessons and promote the health and development of kids in Flint and beyond. We just launched a program that was mentioned in the intro called RX Kids in Flint. We launched in January. It's a prescription for health, hope, and opportunity. Every pregnant mom and every baby in Flint is prescribed cash to eliminate maternal infant poverty. We raised $43 million in 1 year, which is amazing. We launched this program. We've already prescribed $1 million in cash. We have a almost 100% uptake rate in the community. And because of the success of that, the governor of Michigan added $24 million in her next budget to do this in more communities. And we already have a federal bill drafted on how to do this nationally. So in a place that is known for failing children, we've really tried to tell a different story of how we can come together to do better for kids.
And speaking of that, we had a question where I was going to ask a little bit about RX Kids, but how do you hope at the end of the day, or what outcomes do you really hope to see for moms and kids as a result of RX Kids?
Yeah, so as a pediatrician in Flint, we've been able to do so much, especially since the water crisis. We have expanded Medicaid and home visiting programs and breastfeeding support and literacy programs and the Flint Registry, like all these awesome things. Yet, like I felt like my hands have been tied, and that I've long wished for the ability to prescribe away poverty. So I think we all know that when kids are born into and grow up in poverty, like it impacts, this root cause determinant of health. It impacts their entire life course. So I was tired of shrugging my shoulders, saying, hey, not being able to do anything, continuing to reactively Band-Aid. So that's kind of how RX Kids was born. And then laser focused on this maternal infant period. We wanted to do a child allowance for all of childhood like other countries do, like we did during the expanded child tax credit during COVID. But that got really expensive. So we kind of laser focused on this pregnancy infancy window. So because of that, we hope to look at lots of outcomes in that space, like maternal morbidity and mortality and infant mortality and prematurity and prenatal kind of utilization and breastfeeding and then also child welfare involvement, which peaks at 1 year. And then because it's a community-wide intervention, we can also look at really cool things at the community level, like how does this impact civic engagement and trust in government and social contract and community violence and lots of different things. So there's a whole huge kind of research arm. Once again, because it's population level, we're leaning on a lot of administrative data. So things like vital records data from birth certificates and healthcare claims data, Medicaid claims, child welfare data, census data. But there's also going to be a survey to look at things that are like well-being and stress and happiness and hope and different things. So lots of outcomes. We're also hoping to kind of transparently share back outcomes real quickly on our website, which I'll post. We have a numbers page where that gets updated weekly. So you can see how many folks have enrolled, how much cash has been prescribed. About 60% of the folks that have already enrolled to date, their annual household income is less than $10,000. Like, that's just crazy. So, this is a life-changing intervention for families that we hope to evaluate and share pretty quickly.
Thank you. In several of your answers, you talked about like making connections, making friends. One of our student questions was, how can healthcare professionals be more aware or be more vigilant about issues that are in their communities?
Oh, that is a great question. So, doctors are I become myopic, which is another reason my book is called What the Eyes Don't See. So doctors don't always do a really good job, like seeing beyond the patient in front of them. There's a poem in my book that I love, that I share with my learners. It's called A Worker's Speech to a Doctor. It was written in 1938. I'm going to see if I remember it. It says, when we come to you, our rags are torn off, and you tap around our naked bodies. As to the cause of our illness, a look at our rags would tell you more. It is the same cause that wears out our bodies and our clothes. So that was written in 1938. Obviously we've come a long way since 1938, but in some respects, the environments, the situations, the conditions of people are still some of the greatest predictors of their health outcomes. I think we all know this, when the data on kind of zip codes and census tracts and life expectancies. In Flint, it's a 15-year difference in life expectancy based on one census tract to another in the same county, and that's throughout this nation. So, I think we need to do a lot of work to continue to educate folks in healthcare that so much of health isn't determined in an exam room, that we have to do a better job investing in what keeps people healthy. And what keeps people healthy is things like fighting poverty, raising the minimum wage, universal kind of healthcare, childcare services, stronger environmental regulations. Like, it's all of these other things which are commonplace in other countries that are investments in health, not healthcare, that are kind of really important for folks, especially in medicine, to be aware of. And we know that, and it's changing. I think a lot of our young healthcare and public health folks get this more than our older folks.
I think that actually leads into another question from students that I have. Where do you think public health and healthcare needs to do a better job of working together to address the social determinants of health? Because I know you mentioned social determinants and ACEs in your book.
Yeah, I think we have to shift our funding priorities. And it's one of the reasons that this new program is called RX Kids. Like, I want it to be very much in the world of healthcare, or have healthcare nomenclature to be able to leverage healthcare dollars. We as a nation spend more than any other country on healthcare for some of the worst outcomes. So I think we need to kind of reprioritize our spending and shift that more to public health, more to prevention, rather than on a sickness reactive based system. And these are some of the same lessons that we learned during COVID. We didn't have the infrastructure, the public health infrastructure, to do the proper surveillance and prevention and address these kind of root cause issues. But we had to continually kind of react to the crises.
Great. Now, we have one more question directly about the issue in Flint, two from students. You talk about how, I think in your book at the beginning of the crisis, it seemed like people were just kind of listening to what was being said and weren't questioning it too much. And the question is, many people didn't address the water issue, but you did. What made you want to make a difference in Flint?
Oh, that's a great question. So yeah, the water crisis was going on for a year and a half. But a lot of people were raising their voice. We had amazing moms and activists going to town hall meetings with jugs of brown water. Our faith community was mobilized. Journalists were asking and digging and digging and digging. Water scientists were also sharing lots of information. And all these folks were being kind of silenced and dismissed. So there were a lot of people raising their voice. But it took the voice of healthcare and health for folks to finally listen. And it shouldn't have been that way. We should have listened to the first mom. And I guess I share that with you to share how important your voice is. The voice of healthcare, public health is a credible voice. People listen to that voice. So don't underestimate the power that you have in your profession to kind of raise your voice in these kinds of big and small injustices.
All right. Before we move on to maybe ask if there are some students who have questions in our chat, I personally just wanted to ask a quick question to you because when I was still in Michigan, I did some time volunteering at a food bank in Flint and got to see sort of firsthand handing out the water and seeing when trucks would bring in pallets of water. But what positives have you seen now kind of coming on the other side of this crisis, even though I know still ongoing, but what positives have you seen coming out of it on this side?
Oh, I love that question. So many positives. A community that has come together. The Flint Registry, which I run, everything we do, once again, is done in this kind of humble, community partnered way. And we were meeting with residents and asking them, like, what should the logo of the Flint Registry be? And then a community member is like, well, maybe it should be the Sankofa bird. And I'll put the website and you could see the bird. And this bird is this mythical African bird from West Africa that's flying forward and looking back, and it's holding an egg in its mouth. And they're like, everything that's happened since the water crisis reminds of us of this bird, because it's about kind of being very forward thinking, about flying ahead, right? But the looking back, never forgetting the injustice in history. We as a nation, we do a terrible job at learning history and kind of coming to terms with history. But it's important to recognize what has happened before us, because that's the only way that we can understand where we are and where we need to go. And then my favorite part of this bird is that it has an egg in its mouth. It's about eating our young. Just kidding. It's about kids. It's about prioritizing children. And that's kind of been the focus of our work. So so everything that has happened since has been about, hand in hand, sleeves rolled up, pushing ahead, never forgetting the past, and doing things in the best interest of kids. And so many good things have come out of it, like, 2 brand new childcare centers and early literacy promotion, this amazing Flint registry, our replacement of our pipes, RX Kids, like all these amazing, the list goes on and on of all these amazing things. And that doesn't even touch on the national ripple effects, like I talked about, that we've been able to do to make sure that these things don't continue to happen. Thank you for coming to Flint and working at our food bank. I welcome anybody to Flint. A lot of people who've never been there, they're like, wow, like this is surprising. Like it's easy to fall in love with the city. It's a city with some amazing history, but incredible kind of loyalty and pride, and a place that has been on the map many times for good and for bad, but a place of kind of innovation, but always, once again, flying forward, looking back and prioritizing our kiddos.
Great, thanks so much. So I think we have a few minutes left here. If anybody has some questions and wants to drop them in the chat, I'll be happy to read them off. We have a couple here already. One, did you ever make friends during the time you were working as a pediatrician and fighting for this cause? Did they stay or leave? And I'm assuming, did they stay or leave Flint?
Yeah, I made lots of friends, all kinds of friends. And that are still there, and some folks that have left. Flint, when this became a national story, it was like in the news a lot. And because of that, like a lot of famous people came to Flint, which was really crazy. So it was like at one point, like a revolving door of celebrities. Even like the Democratic presidential candidates had their debate in Flint. So like Hillary Clinton was debating with Bernie Sanders in Flint. So a lot of those folks have remained friends and have stayed connected. Chelsea Clinton came to my clinic. She was pregnant. She has a public health degree. She asked the most brilliant questions. She remains a good friend. She's the she's the co-chair of our RX Kids Advisory Committee. She helped launch my book tour. She's featured me in a couple of her books. She writes children's books. She wrote a book called the She Persisted series. There's one about she persisted in science, and I'm featured along with Mari Kopeny, who was also mentioned in the chat. So have held on to a lot of these friends who haven't left and continue to care.
Well, and speaking of Mari Kopeny, that question, how do you as an academic scientist collaborate with activists in spreading information and awareness about a topic to a layperson?
Yeah, we do a lot of collaboration. So remember, kind of Flint's story was a story of democracy taken away. So central to our recovery has been the deliberate inclusion of people's voices. So I have a director of community engagement on my team. I have a parent advisory group. I have a group of kids and Mari's one of them, that advise me. I have another new group of pregnant moms that we work hand in hand with. So this work towards participatory democracy and self-determination is part of our recovery, which is important, Flint, for the reasons I shared, but is really important in all public health work. All our work in public health really should be, by humbly listening and working in partnership. So I continue to work with all these folks, to do this important work. RX Kids not only was born of kind of this inability to wanting to prescribe away poverty, but also from listening to my parent advisory, who for years have been sharing how hard it is to get by. So through their lived experiences. So yeah, that's been part of this work. And we've tried to kind of formalize that infrastructure to make sure that those voices are always at the table.
Just a quick follow-up to RX Kids before I get back to our student questions. How do you approach getting buy-in on a new program like RX Kids? How do you approach getting buy-in from important stakeholders that are going to help fund something like that?
That's a great question. So, I think what I've learned is I share the science and I share the stories. So I share the science that, the perinatal period is the peak of poverty. I share that a child's brain doubles in size in the first year. I talk about ACEs and toxic stress and that what happens in that early childhood period really predicts life course. I share the science that Flint's the poorest city in the state with a child poverty rate of 69%. So I share numbers, but I also share stories. I was in clinic yesterday and I had a family with a 3-day-old who got the pregnancy cash prescription and is now going to get the monthly infant prescriptions. And they shared how this was life-changing for them, that they were able to afford a car seat and a baby monitor and diapers, and that they're starting to put away money for the kids' savings account. And I asked the dad, like, what do you like about this the most? And he's like, I love that it's for everybody. It doesn't make me feel shamed or stigmatized. It's recognizing that we're all struggling. Another story, I had a 4-day-old that missed their clinic appointment earlier this year. And when we called, this baby needed to be seen. It was a preemie, 5 pounds. And the mom had to go back to work at 4 days. So this is the why. These are why we do these programs, not only based on the data, but also on these really important stories. So sharing those stories, I also learned to get kind of buy-in often from policymakers. I have economic data in my pocket. I talk about kind of the return on investment and the societal savings and the economic how this is also a jolt to the local economy and it's a community development. So I also share a lot of that, which I've learned is important. One of the last times I testified before Congress, there was a congressman who said, we can't afford replacing lead pipes. And I had in my pocket the cost of inaction, that when we don't replace lead pipes, it costs us more money if you add up special education and criminal justice and healthcare and all these other costs. So those arguments are also increasingly important depending on who your audience is.
Thank you so much. I think we have a couple questions in the chat that might take us right to time, but I don't want to miss them. One we have from Kiara here. There were a lot of people who greatly frustrated you during your battle for the people of Flint. Do you think they should be forgiven? Do you think that your advocacy inspired them to consider maybe their irresponsibility within this issue and the adversity that it caused?
Great question. There's been a lot of efforts in Flint in regards to truth, accountability, justice, which are largely incomplete. There was a settlement of civil cases. The criminal cases didn't go anywhere. There's a line in my book in the beginning where I talk about the villains of the crisis. A lot of people ask, like, who should go to jail? Who should be held accountable? What do you think? And I really pivot and share that, it's not about the people, that a lot of people that kind of turned their blind eye and covered up and did the wrong thing. But the real villains of this crisis and of so many injustices are the ones that we should go after. And those are the villains of ongoing racism and inequality, and capitalism and greed and anti-intellectualism and neoliberal, like all these other villains are the folks that we should be going after and holding accountable, rather than these people. But I've also learned that without justice, it's a health issue. So you can think of like what happened in Flint, this injustice, as like an open wound. And without some element of accountability and justice, that wound never heals. So it's important for those of us who work in public health and health to demand justice, because that's part of healing and recovery. We know what the raw emotions of anger and fear and betrayal and lost trust can also do to people's health. It's a trauma. So it's important to prevent those traumas, but it's also important to try to heal those traumas.
All right, I don't see any other questions, but I do have just one question that I would like to ask you, just for our students here. Are there any words of advice or encouragement you might give to future students or students who are going to be our future public health professionals?
Yes. You guys inspire me. If you look at kind of what's happening in the world, it is being led by you. It is all these big movements, climate change, gun violence, Black Lives Matter, like, the reproductive rights, it's being led by young people. So thank you for not accepting the status quo. Thank you for fighting for a more just place. The lesson of Flynn this is not a story of crisis. This is a story of resistance. This is a story of refusing to accept that status quo, working with others, and then building hope. ARCS Kids, the first time I wrote a grant for ARCS Kids, it was a big idea grant at my university, big idea to address health equity, no cost, what would you do? And I'm like, I want to do this child allowance program. And I got denied. They said, good idea, but not feasible. And my response was like, F you, I'm doing this. So do not, sometimes we have a failure of imagination. Keep dreaming big. You can do this.
All right, and following that great answer, and thank you so much. I do have one more question that I do really like. For those of us inspired by your book, what other books might you recommend that our students read, if you have one or two that you could recommend?
Oh my gosh, so many books. The back of my book has like a recommended reading list. My website also has a recommended reading list, which I actually haven't updated recently. I don't know. There's so many powerful, amazing books out there. The last book I read, I finished 2 days ago, a book by David Leonhardt from the New York Times. It's called Ours Was a Stolen Future. It's about the American dream, kind of follows the American economy over time and why it's hard for folks to achieve that American dream and rising inequality. And I thought that was a really good book. I don't know. I also I love murder mysteries now. I'll read all kinds of books, but I don't think I could pick kind of one. But check out the list that I have on my website. I'm also on Goodreads, so I try to add the books that I enjoy on there as well.
Well, thank you for letting me put you on the spot in terms of book recommendations for everybody for just a moment. I think we're just about at time, and I think have gotten through all of our questions. Thank you so much for taking the time out to speak with us and our students today. As I can see in the chat, it seems like they were really appreciative, and we are very appreciative for you and your time today.
Thanks for having me, guys. Thank you, thank you, thank you. Take care. I appreciate it. Oh, it's so sweet. Love the chat.